All right, it's 10 o'clock on Friday the 13th, 2020, and we'd like to get this second press conference of the Johnson County Emergency Management Agency Emergency Operations Center and the Joint Communications Center underway. This is in response to the COVID-19 2020 outbreak of the now declared pandemic. My name is Dave Wilson, D-A-V-E-W-I-L-S-O-N. I'm the director for Johnson County Emergency Management Agency. We'll have some folks coming up here with prepared statements. We have representatives from Johnson County Public Health, University of Iowa Hospitals, Mercy Iowa City, VA Hospital, Iowa City Community School District, Lone Tree, Solon, and of course the University of Iowa. Some of these folks will have prepared statements that they want to make, and so we'll get through that as quickly as possible. I'd like to thank you all for coming out and covering this event, and we appreciate your time. I'll turn it over to Dave Koch. Dave Koch is the director of Johnson County Public Health, and he's got a few prepared remarks, and then he'll move on. Thank you.
Thank you, Dave, and thank you for everyone being here this morning. Last name is spelled K-O-C-H. Johnson County Public Health continues to work with Iowa Department of Public Health and a number of local public and private partners to contain the spread of COVID-19 and mitigate its potential impact in Johnson County. There are currently 14 positive cases in Johnson County, and all are individuals from the Egyptian cruise. At this time, there has not been community spread of the illness, which means that there are not individuals in Johnson County who have tested positive for the virus who are not sure how or where they became infected. For the general public who are unlikely to be exposed to the virus, the immediate risk of COVID-19 is still low. Those most at risk of the virus are older adults and individuals with underlying conditions. In light of the Iowa Board of Regents announcement Wednesday that all state universities will move to online coursework for 2 weeks following spring break, Johnson County Public Health wants residents to know that we recommend following CDC's guidelines and considerations for school closures, which were just updated this morning. Risk to students and staff is minimal, and the current situation does not warrant closing schools. Johnson County Public Health, in conjunction with Iowa Department of Public Health, will update recommendations if the risk to students, staff, and families change. The CDC is currently recommending that schools postpone or cancel all international trips. Students and staff returning from travel to areas with community spread of COVID-19 must follow the guidelines they have received from Public Health. Although the CDC does not generally issue advisories or restrictions for travel within the United States, there are several things that you should consider when deciding whether it is safe for you to travel. Crowded travel settings like airports may increase your risk of exposure to COVID-19 if there are other travelers with the virus. If you do decide to travel, be sure to practice precautions to prevent acquiring this virus and other respiratory diseases during your travel. That includes washing your hands often with soap and water, covering your nose and mouth with a tissue or your arm, and avoiding touching your eyes, nose, and mouth. We continue to follow the guidance of the Iowa Department of Public Health, and at this time, IDPH is not making any recommendations to cancel planned events and mass gatherings. The CDC recommends that event organizers do prepare for the possibility of outbreaks and ensure they have contingency plans in place should the need arise. We also look to the experts and leadership at IDPH for best practices regarding the safety of our employees and the public while continuing to provide regular county services. At this time, there are no changes to normal procedures for Johnson County governmental offices and departments. Again, be assured that Johnson County Public Health is in constant communication with the Iowa Department of Public Health and our local healthcare providers, and we are dedicated to containing the spread of COVID-19 and mitigating its potential impact. And with that, I'll turn this over, the podium over to Suresh at the University of Iowa Hospitals and Clinics.
Good morning. I'm Suresh Gunasekaran, CEO of the University of Iowa Hospitals and Clinics. Brief statement on our operations. The good news is we're fully operational. We have implemented a 4-part plan to ensure that we are fully prepared for COVID-19 treatment. First, on our inpatient setting, we have a dedicated special isolation unit with dedicated staff and personnel that are fully prepared, trained to manage patients that require inpatient care. We've also implemented safety protocols both within the unit and across the house to ensure that all of our staff and caregivers are safe and can safely manage any inpatients. Our second area, the emergency department, is also fully prepared to meet the broader community's needs as well as patients that may require specialized attention. We continue to have significant volumes through our emergency room, but we've been able to successfully manage that throughout this entire time. Our third pillar, which we're most excited to announce, is that we have launched a special video visit service for patients that are concerned about influenza-like illnesses and potentially COVID-19. You can access that through our call centers or through our website. This will be our first line of protection to ensure that those patients that are concerned about their illness can get screened without needing to come to campus or needing to come into clinics. We have also set up dedicated follow-up clinics for those patients post-video visit that may require specialized attention so that they can go to dedicated spaces with dedicated staff trained and prepared to manage their needs. In this time, the University of Iowa hospitals and clinics will have to modify operations to ensure the safety of not only our patients but also our staff and caregivers. One major change associated with our operations is our change in visitor policy. We are reducing the number of visitors consistent with community protocols to ensure that we are mitigating risk to our patients and our staff. We have also implemented mandatory screening of all visitors at our entrances. So it may take you a little bit longer to get into the hospital, but the bottom line is we would really like to limit the number of visitors for all inpatients. Our general guidance is during this time, there are ways to keep in touch with your loved one through your phone, through your laptop, and we encourage you to take advantage of that. We will be very stringent in limiting visitors. Any visitors to hospital patients that are exhibiting symptoms will be turned away. They will be offered the opportunity to participate in video visits, but we will not be allowing any visitors that are displaying any symptoms that are relevant. With that, I really want to encourage the community to follow best practices and manage social isolation as well as follow hygiene guidelines. But in the event that anyone in the community does need support, the University of Iowa hospitals and clinics are prepared to help you. Thank you.
Thank you, Suresh. And now we will have Margaret Reese from Mercy, Iowa City.
Good morning, everybody. It's nice to see you again today. The name is Reese, R-E-E-S-E, and one of my roles at Mercy is Director of Communications. So Mercy, Iowa City has prepared for the last several months to respond to an outbreak of COVID-19 should it come our way. And now that it is here, we are ready. We implemented our emergency response plans a week ago and have appropriately treated those who have come to us for care and reassurance. We are prepared to care for suspected and confirmed COVID-19 cases who may arrive in the future. We continue to communicate daily with public health officials and our community partners to closely monitor the situation, and we are following every policy and procedure and protocol to keep our patients, colleagues, visitors, and others safe. We have canceled classes, meetings by outside groups who meet at Mercy on a regular basis, shared information about personal travel with all of our colleagues and volunteers. We have limited public access to our buildings and have restricted and are screening visitors. And all of this is to protect the health and well-being of our caregivers and our patients. And these things that we have implemented have been met very, very positively by everyone that we have encountered. They're very glad that we are doing these things. We advise that individuals with symptoms call Mercy on Call, which is our 24/7 nurse triage line, their provider or urgent care before they go to a clinic or a hospital. And that's very important to call before going to a clinic or hospital. They will be screened over the phone, and if they need to be seen, will be directed to come to the hospital where they will be met and immediately isolated to protect caregivers, patients, and others, and they will receive the appropriate care. Please pay attention to the precautions that have been mentioned already today, such as washing hands often, staying home if you are sick, avoiding large crowds of people, and so forth, the social isolation, not to be impolite, of course, but to protect others. Those are very, very valuable. This is preventable, so those precautions should be followed, and go to the CDC and Iowa Department of Public Health for more information. Thank you.
Thank you, Margaret. We will now have Rod Lennertz from the University of Iowa.
Thank you. Good morning. Rod Lennertz, R-O-D, last name L-E-H-N-E-R-T-Z, Senior Vice President, Finance and Operations for the University of Iowa. I have comments with headings. I'll go through this and stick to the script and the words that we've prepared for this, so I apologize for looking down, but I want to make sure that we cover the information. We have a lot of fronts at the University of Iowa. First, on travel. We continue to encourage members of the University of Iowa community to strongly consider deferring personal, non-essential international travel during the spring break and in the weeks ahead. The Board of Regents has also issued a rolling 30-day suspension of university-sponsored international travel effective March 5th, 2020, and will make a decision weekly as to whether or not we will expand or extend that suspension. All University of Iowa healthcare work-related domestic and international travel is suspended until further notice, as you can imagine, and as Suresh Gunasekaran mentioned, the importance of not only our people and the care for our patients, but in tracking and in coordinating a lot of the work that we are trying to do on behalf of this matter happen at UIHC. We're so thankful that we've got a world-class healthcare system right on our campus, but it takes special attention to make sure that we stay ahead of and address the issues in front of us. The University of Iowa has not restricted UI-sponsored domestic travel at this time, and we will continue, as others have, to follow the lead of national, regional, and state direction and advice on that front. The CDC has now issued or raised the risk assessment for much of Europe to a CDC Level 3 travel warning, and the university recalled all students studying abroad in these countries on Thursday. The university has also asked these students to self-isolate for 14 days upon their return in alignment with CDC guidelines. The new entry restrictions to the U.S. do not apply to U.S. citizens, permanent residents, or their immediate family members, but we do strongly urge them to make arrangements to come home immediately. Next heading, online instruction, events, and athletics. Our primary objective is to protect the health and safety of our community while continuing to provide a world-class educational experience for our students. Following the identification of COVID-19 cases in Johnson County, the University of Iowa suspended face-to-face instruction for 2 weeks following the spring break. The university will move to virtual instruction beginning March 23, 2020, and continue online courses through at least April 3, 2020. This means following spring break, students may choose to stay home or return to their residence hall, off-campus housing, or other locations. We are making this decision proactively to maintain the health and safety of our students, faculty, staff, and patients in conjunction with the governor and the Board of Regents, State of Iowa. In addition, the university has decided to cancel all non-essential face-to-face meetings and events effective Monday, March 16, 2020, through at least April 3, 2020. Groups and events scheduled after April 3, 2020 are urged to begin considering alternative plans in case events further into the future will need to be canceled or postponed. The university will make a decision about commencement ceremonies soon. We recognize the importance of making decisions on travel related to and planning related to these important events in a timely manner, so we will be working on that and getting more news out in the near future. At a minimum, we will continue to follow the recommendations of the Centers for Disease Control and Prevention and the Iowa Department of Public Health, and the university remains fully prepared to diagnose and treat any potential patient who might be infected with the virus should the need arise. During this period, the campus will remain open to serve those who rely on the University of Iowa hospitals and clinics, the university bus system, CAMBus, and our libraries. One exception is one exception to this would be our recreational facilities on campus, which will be closed Monday, March 16th through at least April 3rd. The closure will include the Campus Recreation and Wellness Center, the Field House, and several other facilities which will be listed on the Recreational Services website, as well as impacts to any programs within those buildings. We recognize this is an inconvenience for both our campus community as well as our surrounding community, but our primary focus is on the health and safety of the members of our community, and practicing appropriate social distance is difficult within the recreation facilities. We have one of the questions that may come up, and I'll just handle it here in case it comes up, a question as to why we're leaving the residence halls open. Not all of our students can immediately return home or find other living accommodations. Some would be returning to areas that have higher rates of COVID-19 than in Johnson County and present a greater risk of infection than remaining in Iowa City. By moving to classes online, we will be able to avoid the contact that would come with larger classes or larger groups, but will maintain that essential access to services on campus, including online service for those classes that will continue. Another question that may be asked, how will you make sure students don't bring COVID-19 back with them if they return to the residence halls after the spring break? Students who return from areas with confirmed cases of COVID-19 will be asked to monitor their health and call the Student Health Nurse Line if they begin to experience symptoms. And of course, along with the rest of the community, as Suresh mentioned, the video services that we are offering for people that come back to campus or to the community and are concerned. If they choose to travel to a country with a CDC Level 3 travel warning due to COVID-19, they will be asked to work with the university to arrange their plans to self-isolate in accordance with the guidance from the Iowa Department of Public Health and the CDC. The university is prepared to help students self-isolate if needed in a way that does not put the community at greater risk. Next heading, athletics. There's been a lot of news lately and in the last 24 hours on this front. As many of you have seen, the Big Ten Conference announced that all conference and non-conference competitions will be canceled through the end of the academic year, including spring sports that compete beyond the end of the academic year, and participation in all NCAA tournaments and competitions. We as a university and the entire athletic department are disappointed for our student athletes, but the university fully supports the actions taken by the Big Ten Conference, knowing that the health, safety, and wellness of our community is most important. With those comments, I will conclude, and as was asked, can take any questions you may have.
Just to make sure, so all of the closures, it sounds like will start on Monday and they'll all go to April 3rd?
That's correct. Okay, thank you.
Thank you, Rod. With that, I will pass it on to Chase Ramey from the Iowa City Community School District.
Good morning, Chase Ramey, ChaceRamey, Chief Operating Officer. I'm joined by Matt Degner, DEGNER, Assistant Superintendent with the Iowa City Community School District. As of now, teaching and learning continues as scheduled in the Iowa City schools. While the district did announce limits on international student travel late last week and domestic student travel this week, instructional programs, student activities, and district and school events continue to take place as scheduled. The district has been in consistent contact with the IDPH and JCPH and will follow guidance from these organizations, as well as the CDC and the Iowa Department of Education with regard to any decisions related to possible school closures. The district recognizes the central role it plays in the Iowa City area and the cascading effects closing schools will have on the entire community. We do not approach this decision lightly. While there are many factors to consider, the health and safety of our students and staff are our top priorities. The district begins spring break after classes conclude today. We anticipate school resuming March 23rd as scheduled. However, any changes to this plan will be communicated to our parents no later than March 19th. Again, as of today, Iowa City Community School District instructional programs continue as normal. We appreciate the support and patience from families, students, staff, and all members of the school district community. Thank you. And with that, we'll take any questions.
Do you guys have numbers yet for, I know sometimes they can tell like how many students have been out of school. Do you guys have any numbers for that?
We have been tracking our attendance for students this week, and given that it's a week before spring break, we see a dip on that normally. So we've looked at last year's numbers. The numbers are down slightly, but not very significantly at all.
This question kind of applies to almost everyone, but are there translators for non-English speaking communities?
I can't speak for the other organizations, but yes, we are translating our communications into other languages for our populations inside the school district.
That is the same for the University of Iowa. Our international programs has been heading that both from a internet and direct communication, email and otherwise.
Great, thank you.
So that is the end of the prepared statements. We will open it up for question and answer. We do have a microphone for our live feed. So please, if you have a question, raise your hand, state your name, your affiliation, and then ask your question.
Hi, Mary Hartel, Daily Iowan. I was wondering if there's been a decision made regarding students studying abroad in countries that aren't at level 3 right now, like Australia or South American countries. Have they been recalled in?
Thank you for your question. It's a good one, and one of the things I will point out in context with that, the University of Iowa, in the model that we have followed back to the 2008 flood, established a critical incident management team. The planning team has been working on many fronts, that being one of those with our academic leaders on campus. At this point, as I mentioned in our comments, we are following CDC guidelines, and so with respect to international issues that are occurring in countries that do not have that, we have not made decisions about suspending those, but it is absolutely a conversation that we continue to have and will watch and monitor carefully.
Phil Reed with KCRG. So on those two cruise ships, how many from Iowa were on the first ship and how many from Iowa were on the second ship?
There was the majority of those individuals on the cruise ship were from Iowa. There were, I don't have the list in front of me, but just a small handful, 2 or 3 that were from different states, but the majority of them were from Johnson County.
And have they all been tested at this point?
They have been tested if they're showing symptoms, yes.
Do you know how many have been tested?
We have 14 positives in Johnson County.
Right.
The negatives are on the IDPH website, and there's also some pending test results as well.
Okay. How can you be confident that there is no community spread at this point, given the minimal testing?
Sure. So the testing will increase as of today, but as far as being assured, we're taking guidance from the medical professionals, from CDC. I know there's conflicting reports in the community about the ability for asymptomatic individuals to spread this disease, but we are following those national guidelines.
You said the majority were from Iowa, correct, on the ship?
Yes.
Okay, and from Johnson County, correct? Or?
Correct.
Okay.
Are you able to release those ages yet? Are we able to get the ages of the patients, specifically the one that's in critical care at UIHC?
Not specific ages, no.
And then I wanted to go over again the qualifications that someone has to meet in order to get the test.
We can get those qualifications for you, but you can also call Iowa Department of Public Health, and they will have those criteria to qualify for test.
So every county is following the same criteria for?
Yes,
Okay.
that is correct.
So I was talking to a couple people from the jail facilities yesterday. Are they going to be having tests like within their facilities ready to be accessed?
I believe Brad Kunkel's here from the Johnson County Sheriff's Office. Brad, do you want to take that?
So, thanks for your question. We are screening inmates or arrestees as they come into the jail. And if somebody were to have some sort of a test result or correction, some sort of an answer to a question that would indicate they need to be screened further, we would contact the Department of Public Health and follow their recommendations.
Question unrelated to you, probably.
Okay.
But as far as both of the hospitals, what is the screening that you guys are doing for patients? Is it just based on travel, or I didn't know if you guys were taking temperatures or anything like that?
So the screening is based on what the Department of Public Health has recommended. We are for sure screening for travel. All of our patients that are seen in our clinics and our inpatients are getting temperatures. And as Suresh noted, we are screening at the door for visitors as well as patients who may have symptoms. Patients will be masked and visitors will be turned away if they have symptoms.
Are you still in contact with everybody that was on the ships?
Yes, we have at Johnson County Public Health, we have disease prevention specialists, that is their main role, not only with COVID-19, but any other communicable disease that is required for us to track and do surveillance on.
And those on the ships that were tested negative for COVID-19, are they in isolation or are you keeping track of them?
We are continuing to keep track of them, correct.
And they're not in isolation, or?
No, some of those are still in isolation, absolutely, through the 14 days.
One other question for probably UIHC, but we have been seeing, like in Italy, for instance, a really high need of people needing to be hospitalized. I know we're not at that point yet, but just kind of curious if there's any numbers on like how many people could be admitted to UIHC or maybe Mercy if they were needing hospitalization.
There's not a precise calculation that we can do in this situation. I think that I was able to talk to Mercy's leadership as well. We're going to stay in close communication to make sure that we are working together to make sure that we have the necessary capacity to do this. I think that the bottom line is that we're, like the national trend, there are going to be capacity constraints as we both have patients already. But as this progresses, we have internal prioritization and ability to ensure that the right patients get access to the right resources at the right time. But right now, we're feeling pretty good about where we are.
I have a question for the University of Iowa. For students who are on work study or required work study, how is that going to work now that depend on that type of?
That is something that we're actively working on. And it's not just work study, but just student employees as well throughout our campus. Many students rely on the jobs that they have on campus and in the community to pay for their needs for education. And so we are working both with our HR departments as well as with each of the units that have student employees to ensure that we continue. We have jobs on the campus. In fact, during this period, we'll have jobs in the recreation systems, disinfecting and other things that we can do. So there are jobs for us to do. It'll take a lot of coordination, and obviously things are happening quickly, but we're communicating with the students that are impacted by that, and we'll also be then coordinating with the units that can provide them both information and the ability to continue to work. Mm-hmm.
There are, I guess this is probably for the public health department. There are statements from, the federal coronavirus task force about how there's a failing on the side of the tests being made available. Is there something you could say to the local community about how that could be impacting the availability? I feel like there is concern, but we're not really feeling like there's a straight answer on who can access the tests and how many there are available.
So as far as accessing the test, as you've heard nationally, those tests are increasing the numbers so that in just this week, Iowa Department of Public Health updated their guidelines for healthcare providers to be able to issue or to utilize those tests more frequently. Does that answer your question? I'm sorry, I might.
Yeah, I guess, could you just be more specific about who can access them and how quickly they could get the results?
That would be a healthcare, perhaps, Dr. Brennan.
So we are told that commercially available testing is available and the Iowa Department of Public Health is allowing it. We are also told that it is somewhat in short supply and the demand is high and that the turnaround time is long. And so I just want patients and others to understand that though we are allowed to do it, this likely will not significantly change the testing. The new recommendations from the Iowa Department of Public Health today may.
This is for University of Iowa, but is there a chance after the 2 weeks of online classes that classes could just be finished for the semester? Is there a minimum number of weeks met for students to not even have to take finals and just cap off their grades where they're at?
Yeah, as with others and even mentioned in the Iowa City School District, we'll continue to monitor where we are. The April 3rd is based on, as has been done in a lot of different areas, we're seeing it throughout the country, a chance for us to decompress the campus and allow for some time not only for us to monitor where things are, but to prepare. And so our intent at this point, as we said, at least April 3rd, our intent would be to get back to normal operations when it's appropriate. If it is not, we will be a university fortified to be able to continue the online process. There are also considerations depending on any type of emergency that might happen where we might consider suspension of a semester. Obviously, we're a university that includes healthcare as an important tenet, half of our operation, and we have students that are in medical school that are also important parts of the team for UI Healthcare. That being the case, it's not just about classes, but with respect to a complete semester, which I think was part of your question, we do monitor through our academic leaders how far we need to go. We know that April is an important part, can play an important part of that. We do not intend to truncate the semester, but we'll monitor the system and the situation and the impacts on the institution up to that point. And we'll reassess ahead of April 3rd to determine the next steps. We're going to keep our students, their parents, the community informed through this. And by the way, it's a moment for us also to say and to thank and to point out Johnson County's work in pulling together these diverse but very interconnected teams. We are, as the Iowa City School District has pointed out, we are tied together. We are in a small community impacting each other every day by the things we do. So our coordination here is very important, and we all do it locally and then come here. And that will continue to happen here. We're meeting every day at the University of Iowa, again, reflecting the flood of 2008. We were doing the same thing so that all parties are coordinated, and our students, certainly our faculty, staff, and community, their health is most important, and for the students, information on that front, making sure they know leaving for spring break that they're going to start after spring break, many of them on a laptop, because we're going to be doing things from a virtual perspective. That can continue past April 3rd. We're all hopeful that we can get back to some normalcy at that point, but we'll all learn that together.
Before, may I, just in spirit of completeness, I want to make sure that my previous statement about testing, at the University of Iowa Hospitals and Clinics, we are in the process of implementing testing within our own facility, not commercial-based send-out. That requires validation and time, but we hope it will be available soon.
There was an earlier question about the age of the positive cases. I know you can't give specific ages, but could you give like a decade range and then also just update? It seems like all of the cases except for one are at home in isolation.
I don't have that information as far as the ranges of the age, but we can provide that to the community and to the media. We can do that. And the second part of your question?
How many are at home in isolation and recovering, and is it just one that's in the hospital?
As far as hospital admissions, I will leave that to the hospitals to comment on. Other individuals are still home, and we're monitoring those symptoms twice a day in contact with those individuals.
How are UI professors being trained to take their classes online? What's the protocol they're undergoing?
Another good question. As one might imagine, over time we've become more and more attuned to teaching either online, partial classes, mixed classes that are together and online. So much of our faculty base is already very familiar with that. We have an information technology services team on the university campus that have pointed a lot of their attention to this, pulling away from other things they're doing to begin a process to make sure that these courses over this next week, those that are not fully able to go today to an online format can be done by the time the students return for the 23rd. So a lot of work is happening on campus. It's not going to be a quiet spring break because our IT professionals are working hand in hand with faculty that need to shift that to an online. We're very confident, despite the fact that it'll take a lot of work, that it will be ready for the students as they arrive. And as I said, a lot of those courses are already either partially or somehow associated with online work or virtual get-togethers. So it's just expanding that program for the most part.
Just to follow up on her question about hospital admissions, can the hospitals address that? Is there any update on the patient who was in critical condition the other day, and have any others been admitted?
So the University of Iowa Hospitals and Clinics has a single positive patient, and that patient, we've given all the information that we can give.
Just one more question about the online learning. So there have been concerns about the bandwidth possibilities of the EDU room servers with everybody using the Zoom program. Can you address any of those? Are they going to be expanded at all, or is that not a concern?
Yeah, certainly. Our CIO, Steve Flagel, who is leading his team on the information technology front, has reported to us while there certainly will be an increase, they're confident that we have the bandwidth that will cover what we need to do. That's an area of confidence that they have. We'll continue to monitor it, just like everything else, and they will continue to work with both the faculty. As you can imagine, there could be hiccups as some who haven't been used to this get started, so we'll have a lot of IT support, if you will, in those virtual classrooms working with them. But from a bandwidth perspective, IT is reporting that we are in a good place to handle the increase that is likely or will occur as the students return after spring break. Yeah, good question.
Do we have any additional questions? All right, if there are no further questions, I would like to thank you all for coming today, and also thank you to all of our community partners for participating today. As it has been mentioned, we will continue to work daily together on this, and with that, I will pass it on to Dave Wilson.
Again, I just want to echo what Rod said. These events, whether they're natural disasters or H1N1, COVID-19, whatever it is, we get through these as Iowans and as Johnson County residents and visitors because of the partnerships that exist. And we have strong relationships, as you can see, with our school districts and a multitude of partners. We meet daily in the Emergency Operations Center, have briefings, do situation reports, put together instant action plans. None of this would be possible without those strong community relationships and everybody focused on the problem at hand. So I'd like to thank the media for conveying our message. I'd like to thank the partners in the room, and I'd like to thank the elected officials in back that attended. We'll be in touch with you about the next press avail, probably on Sunday, to let you know what the schedule is for the week. And thanks for coming out.